It was living hell. To be blunt about it, it was awful. It was every movement, you were just waiting for it to shock you, and it just wore you out. And it was just not being able to really chew, bite into anything, or roll over in bed without being shocked. I was sleeping sitting up, so it wouldn't happen, which wasn't great. We did research online, which is wonderful, about the Gamma knife, and so we decided to try that. It's a little more involved than the CyberKnife, but it involves a halo on your head, and you have screws screwed into your skull, and you have to hold real still. Well, I moved here to Louisville to help take care of my grandchildren, and they start getting shocked again. So anyway, then I saw Dr. Nada. He did surgery. It was 5 hours of surgery, and it took about probably a month to really recover from that. In the hospital 4 or 5 days. But again, when the pain from the surgery went away, there was no more pain from the trigeminal nerve. Then 2 years later, here it comes again in a different place, and I decided, well, I talked to Dr. Nada again, and he said he could do surgery again, but we asked about this CyberKnife, and he said we could try that. So I went into Dr. Wu and had an appointment, and decided to set that up and give that a shot. And I did, and it worked beautifully, and it was so much easier than anything else I had done. This is what it ends up being like. They mold it to your face. They put this is all like fabric, and they get it wet and put it over your face, and you have to hold still for a while. And then it comes off, and this is what they get, and they put the plastic around it, and here are the little holes. I guess it screws down so you don't move around. Instead of having holes drilled in your head, it's drilled in the plastic here, and this holds you still, and that was it. I just kind of meditated for a while and didn't move, and it was done. It was great.
She has trigeminal neuralgia. Trigeminal neuralgia is really diagnosed clinically. It has very typical symptoms of one-sided facial pain, and this is really the simplest treatment. It's one treatment, outpatient, takes an hour, and that's that. Now, it has some side effects, but it's not a high degree of side effects. The major side effects is that you may have some numbness, which could be permanent on the same side of the face. And my understanding is she had great relief of her pain.
2 years later, here I am. Doing great, still smiling, and can eat and roll over on my pillow without waking up. It's great. I'm back to normal, watching my grandchildren and smiling, and it's just great to be able to live normally again.